Hey, what's up, everybody? Welcome to Wellness Week Live. I am your host, DJ Anthony. Look, it says it right there. So I must be a DJ. No, seriously, I'm a professional DJ. I'm not kidding. Okay, so on this episode, I want to talk to you about, so you don't have health insurance. You know what? The first thing I would do is freak out. No, just kidding. Although I did. I've been there. I've had no health insurance in my life. And I've had the spectrum in my life where, I've had health insurance through when I was younger as a child through my parents. And then, off to college and life. And I've had, no insurance. Very scary. Unsettling. And I've had the best of the best insurance. And now I have the meh insurance. It's don't die, don't get sick type of insurance. You probably understand what I'm saying. I think most of America has that type of insurance, high deductible type of deal. But I want to talk to you about, what happens when you have no insurance, and that is really scary. That's not a place anybody wants to be. And, I wanted to just dispel a myth. I think a lot of times we hear, or some people may hear, that they don't have health insurance, or he or she doesn't have health insurance. And we might assume, oh yeah, they're just lazy, or bums. And that's actually couldn't be further from the truth. Millions and millions and millions and millions and millions and millions and millions of hardworking Americans that work 50, 60, 70 hours a week and have a place to live, and they're law-abiding citizens, and they're working hard, don't have health insurance. Even with the Affordable Health Care Act, there's still people that fall through the cracks because, you make enough where you don't qualify for any substantial subsidies, but you don't make, so low amount of money that you would be able to afford something. Or, if you're making zero or so low, you would qualify for, I think it's Medicaid or Medicare. I get confused with which one. But so this segment, I wanted to talk about what if you don't have health insurance. And I've been there. So yeah, it is scary. It's unsettling because, the obvious, a million thoughts go through your mind. So, what can one do to manage that, mitigate some of the open flanks, so to speak, when you don't have coverage? So I want to share some tips with you about how I managed through that. So the first thing is, when I didn't have health care, what I told myself, and I'll tell you, is that arguably 50% of our actual health care is no matter if you're a billionaire or not, 50%, give or take, you and I are responsible for. Meaning, do we smoke? Do we drink? Do we live, on a life that is wrought with a lot of danger so far as our health care? Are we not taking care of ourselves? Are we, do we exercise? Do we sleep right? Do we eat right? Do we drink right? Meaning water, not beer, water, not soda, water, not juicy drinks, things like that can help us greatly stay out of the ER, and I think sometimes we forget about that. That's healthcare too. Again, how we live our life, our lifestyle. So that's the good news. No matter what, whether you're a billionaire or you just scratching by, about arguably, I would say 50% of our healthcare is we are in control of, no matter what. Okay, so we got that 50 taken care of. The other 50%, yeah, that's a problem, because when something does happen and you don't have health insurance, and I've been there, what do we do? So number one, I would recommend that, you got to, I have to prioritize, right? Do I need the 17th pair of shoes, or do I need the latest phone? Do I need the largest flat panel screen or a flat panel television screen? Do I need to go on that weekend getaway? Do I need to go drinking with the boys or the girls? Do I need to, have that vacation this year? So with that mindset, I would recommend, when I was with no health care, I would go to like these walk-in clinics, or around the New York City area where I'm from, we have a thing called CityMD. Great place. Love it. No appointment necessary. Good quality doctors. You walk in, they see you. You can pay cash, credit card, debit card, check. If you have some kind of health insurance, fine. But the great thing is, so I would pay. I needed to get a checkup, a physical. So it cost me about, I don't know, a little under $200. Now, before you scoff, again, if you got money for the latest iPhone, you got money for movies and a weekend to go here, go drinking, go out to eat, you got the money to get a checkup. It's your health. It's your life, So that's the good thing. There's places like CityMD out there that, like I said, for basic care, right? You got a sore throat, you need a physical, totally a place to go. Even if you have $1 billion, great place to go. So that's a good thing. So, I want to, give you some sense of, it's not all or nothing, so there is some type of safety net. So you have that. Let's start off with that. Okay. And again, great place for physicals and you sprain your wrist or whatever. Okay, so now after that, let's just address the 800-pound gorilla in the room. We're all afraid of, God forbid, we get into a massive car accident. Okay, first things first, you're knocked unconscious. You're going to be taken care of. You're going to the hospital. They're not going to let you die. You know what I mean? You're going to get health care. Everything's going to be taken care of so far as you living and making that recovery. The question is, wait till the bill comes in. So I've had something similar happen. So I had to go to the hospital for an eye injury. And, I did not have, I don't think I did. I didn't have healthcare at that time for various reasons. This is in the past. So, yeah, I had to go to the ER, and it was scary because, one, because of the injury, but two, I'm like, oh boy, the bill, so the bill comes. The second thing you're going to do, so the first thing is, for regular checkups and stuff like that, you go to the outpatient places like CityMD, etc. Okay. Second thing, ER stuff. Okay. You're going to pay cash. You're going to go to the bursar's office or the office when you're done, a week later, 2 weeks later, whatever, or write them a letter or an email, whatever. You're going to pay cash. This is told to me by a hospital that I went to. They said to me, and I'm paraphrasing, oh, you're paying cash? 90-something% off the bill. So the bill was approximately, give or take, about $10,000. They were like, under $1,000 cash. Wow. So I said, wait a second, let me get this right. Let's just say I had to have a heart operation, God forbid. And a heart, depending on where you live, a heart operation is, depending on what kind of operation you need, you're looking at about, give or take, just the operation alone, about $100,000. So you pay cash, you're getting 90,000 plus percent. You're getting $90,000 or more off the bill if you pay cash. So my point is, cash is king. That's number one. So you're going to work with cash. The other thing is, they're not going to, once you get a bill, this is the other fear I think people have subconsciously. They're not sending the SWAT team to your house if you're late on a payment or you're struggling to pay. It's not a criminal case. You got into an accident, something happened. So relax. No one's going to come in with a tank and take away your life. But yeah, you're going to get billed. You're going to have collections probably, whatever. Here's the other tip I have. Communication. You're going to communicate. That is the key. It's embarrassing or uncomfortable or whatever. I get it. I'm human. I've been there. But you have to communicate with the hospital, with the third-party billing agency, with the doctor's office, whatever. You're communicating. So you're letting them know, hey, listen, I can't make the full payment this week or this month or this quarter, but I'm going to send in whatever it is. I'm going to send in $1,000. I'm going to send in $500. I'm going to send in $10. You want to stay busy. You want to show goodwill. And, don't try to play the system. Be honest. But if you're being honest and you're trying your best, it's going to all work out for you. So, but the key is communication. You're going to hear me say this as a theme here in this segment is communication. Also keeping track of, when you communicated and with who, times, dates, names, who you communicating to, those phone numbers. So you have a log so you can, prove to people when they say on the phone, oh, we didn't receive this or that. No, I spoke to whatever, John at 3:15 p.m. on whatever, June 2nd at your office. And, he said this. So it's important. That shows you're being responsible. This is your life. This is your health. So, communication. The more you communicate, the more breaks you're going to get, and don't forget, as much as we like to demonize, the hospitals and healthcare doesn't care, 99% of the people in healthcare, they do care. They want to help you. They don't want to hurt you and they don't want to hurt your wallet. So communicate. Go, listen, I'm having a problem making the payments, or I'm going to pay cash. We can take care of this right now. Boom. And so you're in the driver's seat, but use that to your advantage in a good way, in an honest way, and be forthcoming, be transparent, and it's going to go very well for you. So there's another tip if you don't have health insurance. So we have places like CityMD, paying cash, communication, taking care of your health, because that's healthcare. I would also say if you have friends or family that know someone, hey, is your cousin a dentist? Yeah, can I go to them? Talk to them, and see if I can work a payment plan out. I need a root canal or I need a filling, so that's great. Most dentist office actually work in cash anyways. Very few healthcare plans even offer a dental package. It's a separate package anyways. So, that's something you need to take care of. Again, prioritizing. teeth cleaning costs about, give or take, $200, $150 to $200. Again, prioritize. I mean, you got money to go out with the boys this weekend. You got money to go bowling. You got money to go to the movies. You got money to eat out. You got money to go for the coffee. You got money for the 19th pair of shoes. You got $180 something for a teeth cleaning once a year. It's important to do. It's your health. You know what I mean? So these are things you can pay in cash or credit or debit. Very, very important. I know when I was a college student, I didn't have health care. Most colleges will work out something with students. I know this was way back in the 90s. I went to my university and I said, I don't have health care. And this was before the Affordable Health Care Act. And like, you were 18, bro, you were out, like you weren't underneath your parents' insurance anymore. And so most universities or colleges or trade schools can work out something with you or point you in the right direction to have some kind of, health net. So it's not, all or nothing, binary 1 or 0. It's not like that. The other thing I would say is prescriptions. Now, here's the other problem, right? So you go to the doctor, you don't have a healthcare plan, but you paid for the visit, whatever, and they want to put you on whatever, Zithromax. Okay, I'm using that for an example. It's usually 5 pills, or it could be anything, amoxicillin, where you're going to need to take 30 pills, whatever. Again, communication, you're going to tell your doctor, your healthcare provider, hey, look, I don't have health insurance. I'm paying cash. What advice can you give me? You're not going to get on your knees and be like, oh my God, please don't. Just say, what could I do? More often than not, the doctor's office will either give you the medication for free, depending, or give you a starter pack and get you going where you can get to the pharmacy and then tell the pharmacy, hey, can I speak to a pharmacist real quick or the manager? I don't have health care. I'm going to be paying cash. Is there some kind of plan I can be put on or something? Again, most people, they want to help you out. They're not looking to hurt you. But if you're not going to communicate and you're going to be presumptuous, you're going to be at a disadvantage. This is your life. You have to advocate for yourself. No one's saying march in the streets, but again, quick communications. So, if you're really good, you want to get ahead of all that prior. So if you don't have health care, make some phone calls, ask your local pharmacy, hey, what happens if I need to do this? Or if you have an existing doctor that you like, communicate with them. Hey, I'm not sick right now and like that, but I need to, or if you have to do routine, checkups for yourself, colonoscopies or mammograms or, any kind of eye exams, get ahead of that before you need to. And again, this is your life. So if you can get ahead of making a vacation for yourself for the weekend or make reservations to go drink, get drunk, you can make reservations for your health. It's very, very important. So there are things that you can do, and it doesn't have to be, oh my God, I got nothing. You have something, you have recourse. Now, obviously, if you have no money and like you are piss poor, there's Medicare, like I said, or Medicaid that is available to you too. And if you make below a certain threshold, you have the Affordable Health Care Act that there are subsidies. But I'm talking about if you have no insurance, or it's too cost prohibitive, because health insurance can cost about anywhere from $300 to $500 or more per month per person. So if you're a family of 3 or 4, that's a lot. Again, but communication, and there's HSAs and all that stuff like that too. But I find it to be a little bit more that can be problematic. I'm just talking straight, like you need healthcare, you need to talk to somebody, you need to, get your sore throat looked at. Again, the Minute Clinics by CVS, I think, have that. A lot of Walgreens have that. CityMD is great. I use CityMD, and like I said, I have healthcare. I use CityMD. Love them. And so these are things that you can do, and your family and friends can do. And again, it's all about communicating. So I think even if you know someone, again, who's a nurse or a doctor or a podiatrist or an ophthalmologist, hey, listen, can you help me out? Look, I'm looking to get my eyes, new glasses. I don't have health insurance, but I have cash. Can we work something out? What's the worst they're going to say? I really don't handle that now. Okay, cool. Maybe, but most people want to help you out. So it's about communicating. You don't have to be on your knees. You're not a loser. I've been there. It's nerve-wracking, because it's always in the back of your mind, like, what happens if this? What happens if that? Even with healthcare, most of us don't even have good healthcare. We have, like the crappy plans, right? Very few people have the gold plan where it's like 100% covered. But so, anyways, I think I covered everything I wanted to speak about. But if you have any tips or thoughts, please put them in the comment sections, because again, this is your health. It's important, and there are things out there and programs out there that can help all of us. So it's a matter of asking and communicating, and that's probably the best advice is reaching out, communicating, go online. But for the basic healthcare, big fan of the City MD or walk-in clinics, minute clinics, things like that, and, it doesn't even have to be a medical doctor. It could be a physician's assistant. I know when I went to the hospital for my eye injury, no doctor even saw me, and I went to a hospital. It was a physician's assistant. He did a great job, and I was very happy with that. So I think sometimes maybe a lot of the older folk out there, or people my age, which is the older folk, they're like, oh, it's got to be an MD. Like, relax. Listen, this is not, we're talking about basic stuff. Your sore throat, your physical, you had an eye injury. This is not neurosurgery. Like, a MD, a DO, a PA, a nurse practitioner, a nurse. They're more than qualified to do the stuff like that, the basic healthcare, and that's what they're trained for. So, big shout out to them, the nurses, the doctors, the PAs, the DOs, the nurse practitioners, and again, they're there to help us. They're not looking to hurt us. So reach out. But yeah, good luck. And like I said, you're not alone. You're not going to be without. You just have to reach out and do a little bit of advocating for yourself and your family. So I know I've been there. I get it. And so that's it. Take care of yourself. That's the biggest thing, guys. Thanks for watching. Check back in. We have a bunch of great shows coming up in the next upcoming episodes and days. So that's it. So Wellness Week over and out. DJ Tony, thanks for watching. Hit the like, hit the subscribe, tell a friend, tell your mom, tell your friend, tell your neighbor. Oh, quesadillas. Tell them that. Okay, that means something in Italian. Like quesadillas means like, what do you say? Io parlo italiano. All right, guys. Thanks everybody. Thanks for putting up with me. All right, everyone. DJ Tony, Wellness Week.